Keeping an eye on imaging. Discussion and commentary based on articles from Jack, Cardiovascular Imaging.
Welcome to Keeping an Eye on Imaging with Jack Imaging. I'm Christopher Kramer from the University of Virginia, and with me today is Dr. Vicente Bodi from Valencia, Spain, and we're here to discuss his very exciting paper about prognosis in acute MI as assessed by cardiac magnetic resonance, or CMR. Dr. Bodi, tell me about the purpose of your study.
Thank you for having me here, Christopher. To begin with, we all know that CMR allows for simultaneous assessment of a wide variety of indexes. And its usefulness for diagnostic purposes is very well established. However, probably due to its rapid incorporation into daily practice for diagnostic purposes, its prognostic validation is still ongoing. And this is a mandatory step in becoming an integral part of the workup of patients. So the objective of our study was to analyze whether or not such a comprehensive assessment could be useful to improve the risk stratification process of post-infarction patients.
So what did you measure in your post-MI patients, and how many patients did you study?
To summarize, we included 214 patients with a first ST elevation myocardial infarction. We carry out CMR studies 1 week after infarction, and we evaluated both in a quantitative and semi-quantitative fashion for CMR indexes. Wall motion abnormalities at rest, wall motion abnormalities with low-dose dobutamine, and by means of delayed enhancement imaging, we assessed microvascular obstruction and the extent of transmural necrosis.
So, and how long did you follow the patients, and what parameters did you find were most predictive of outcomes, and what were the outcomes that you measured?
We followed up patients for a median of 553 days, and we documented 21 cardiac events, including cardiac death, myocardial infarction, and readmission for heart failure. In the univariate analysis, all CMR indexes are associated with patient outcome. Patients with cardiac events displayed a large extent of systolic dysfunction at rest and with low-dose dobutamine, higher risk of microvascular obstruction, and a large extent of transmural necrosis. However, in a complete multivariate analysis, we observed that the only dependent variables were systolic dysfunction at rest and the extent of transmural necrosis. Interestingly, each additional segment displaying transmural necrosis 1 week after infarction independently increased the risk of events by 30%.
That's very interesting data. Other studies in the past have suggested that microvascular obstruction has a very important prognostic role and maybe more important than infarct size, but your study is slightly different. What do you think explains the differences between your study and some prior studies?
Actually, in the univariate analysis, the presence of microvascular obstruction dramatically increased the risk of major events. However, I think that we have to take into account 2 factors. First of all, we do know that transmural necrosis is the most powerful index to predict late systolic recovery. And of course, we do know how important is systolic recovery in terms of prognosis in post-infarction patients. And secondly, we have observed that CMR indexes display a very dynamic behavior during the weeks and months following infarction. And specifically in the case of microvascular obstruction, it tends to vanish in the vast majority of patients during the following months, whereas the extent of transmural necrosis remains stable. So if we take into account the strength of this index for predicting late systolic recovery, as well as its stability from the very first days, we can easily understand why this index is so important in terms of prognosis.
So how would you suggest that imagers and physicians who take care of acute myocardial infarction should use the kind of study that you've presented here?
Well, this is a small step forward, and several issues have to be addressed, such as cost, availability in more institutions. We do need further multi-center trials, but hopefully our results and the results of other recent studies can be helpful to endorse in the near future the inclusion of CMR in daily practice, not only for diagnosis, but also for risk stratification soon after myocardial infarction.
Well, thank you for coming today and talking with us at JACC Imaging. We think it's a very important paper. Congratulations.
It was my pleasure.
Thank you.